Alrighty, so I guess we can go ahead and get started. Thank you for joining, everybody, and welcome. I'm Julia here with Inspira Advantage. We're a college admissions consulting group dedicated to helping prospective students get into the medical school or professional school of their dreams. We've got a really good and exciting webinar for you today, all about the MMI. And joining us, we have two really awesome panelists, which I'll let them introduce themselves soon. But first, let's go over and jump into what we're going to be talking about today with this agenda. So, of course, we'll go over introductions to our panelists, like I mentioned. Then we're going to go ahead and discuss what an MMI actually is as a part of the application process, the format of the MMIs and what you'll expect, the types of MMI questions that you'll get asked and the best ways to respond to them, the list of schools that use the MMI format so you can cross-reference the schools on your application list and see if they're using the MMI format. Then we'll jump into how the MMI is actually scored and then tips to help you prepare for the MMIs. Lastly, we'll have a Q&A section. So if you have any questions that come up throughout the presentation, I'd ask that you kind of hold until this moment. This is where we'll really dedicate some time to answer the questions that you may have. And you can ask those questions in the little chat box here. Okay, so with that being said, I'll go ahead and let the panelists introduce themselves. Elle, if you want to go ahead and start first.
Hey everybody, I'm Ellie. I'm a student at Duke. I'm on my clinical year right now, interested in general surgery, and I'm happy to be here to talk to you about MMIs. Super fun.
And hi, everyone. I'm Aditya. I'm currently a radiology resident at Mayo Clinic in Rochester, and I went to school at Mayo Clinic as well.
Awesome. Thanks, guys. Let's go ahead and jump into what is an MMI?
So I think Ellie and I will just kind of go back and forth on the slides. So an MMI, for those that don't know already, is just a series of multiple mini interviews. What MMI stands for. It's a new method that a lot of medical schools are using to try and get a better sense of who you are as an applicant. Traditionally, interviews have been somewhere between 30 to 45 minutes with just one person, and that can introduce a lot of bias because you may get along with one person, you may not, and it could maybe make or break your interview day. The purpose of this is to have more people be exposed to who you are, be able to see how you problem solve, how you think through situations, and show some of your softer skills. And it's supposed to be a little bit more standardized in the process so that people can tell how much emotional IQ and things like that you have to become a physician.
Yeah, I totally agree with all of that, especially the part about the bias. I think that it is stressful to kind of bounce between interviews every few minutes or so. But if you end up with an interview for 45 minutes with someone that's really difficult for you to connect with, it can really influence the decision that the school makes on whether they admit you to their medical school. So I think that's a really positive way to look at MMIs. It's a chance to connect with 8 to 12 different people from the university or medical school where you're applying.
For sure. Alrighty, so what can we expect on the MMIs? What's the format like?
So the format of the MMIs, because it's like multiple stations, they, again, try to make everything as standardized as possible. They'll probably give you about 30 seconds to a minute in front of each door. The door will be closed where you can read the prompt and you can have some time to collect your thoughts or figure out what you're going to say. As soon as you enter the room, the time goes live. It's about, you'll probably have around 8 to 10 minutes within that room. And they're pretty strict on the times. And within that, you'll just kind of do whatever the prompt is asking you. Sometimes the prompt is asking you to answer a question. Sometimes it's just to go through a scenario. And sometimes this prompt will be inside the room as well, or it may just be outside. So it's important to just kind of take notes and mentally prepare for what you're about to go into.
Yeah, and I think when I went through the admission cycle, it was virtual, and I think that a lot of you will also have virtual MMIs if you're applying right now. And so the actual physical space in the prompt outside of the room isn't really going to apply, but you're going to go to different breakout rooms in like a Zoom setting, and you will kind of be instructed to return back to the main room and then enter a different room. It varies a little bit by university, but it's very much like the rooms in person are going to be the different breakout rooms on Zoom. And you generally won't see the prompt until the person on the other side reads it to you. So you won't like read it before you go into the Zoom room. So it does require you to think on your feet, but with some practice and like some experience starting to answer questions on your toes, then you'll do great with those.
I feel like the first step is always the hardest, and when you jump into the interviews, you'll probably get used to it, right?
Yeah, exactly. It's that initial adrenaline rush, and then you just kind of go into it. So as we were saying before, the timing is pretty strict, and especially even with the Zoom format, they'll probably be able to pull you in and out of the rooms. Once the bell starts, you have 8 to 10 minutes to answer that prompt or do whatever they need you to do. In the virtual format, I'm sure they're going to let you have like a clipboard and paper to take some notes. But you're not really going to have much time to really sit and prepare an idea. You're just going to have to go in and do it and think quick on your feet.
Yeah, I think it's relatively uncommon to take a lot of notes in an MMI because you're talking to usually one person and you're having a conversation or you're answering things. The only thing I can think of is if they gave you a scenario and like actually set aside a few minutes for you to take notes and like formulate your response. But I think it's more common to just be asked a question and then have a conversation. But yeah, they'll definitely, depending on the university for the virtual format, they'll send you kind of more detailed instructions on, what you're allowed to have with you in your like personal space while you're doing the MMI and like what's not allowed. So that will be pretty clear.
Okay, let's go along to the next step.
And this part of the we'll go into like the types of questions and things later, but one thing we just wanted to address was the part that kind of psychs out people the most is if you feel like you bombed one of the stations. First of all, you're not going to know. The interviewer is not going to tell you one way or the other. They're not going to say good job or anything like that. It's very, very standardized and non-biased, and so you can't let that get to you. You may think you did really poorly, but in reality you didn't. And so again, it's just about that mental endurance and resilience. If you feel like you didn't do so well on one station, you have 7 or 8 more to redeem yourself. There are many interviews during my time where I felt like I did really well. And then I felt like I didn't do so well on a station, almost to the point where I was like, well, I'm not getting in. And, you get surprised at the end. So don't get too caught up on just one station.
I totally agree with that. And it can be really hard if you have a frustrating station where maybe you weren't able to formulate a response that you were confident in, or maybe you stumbled a lot. I remember in my experience, I had one interviewer who I really couldn't understand very well for whatever reason. And I couldn't really answer it was just very stressful. And I was like, oh my gosh, I'm done. This is it. But I actually ended up going to that medical school. So don't let yourself get too stressed out. Like, it's really important to be able to kind of move on to the next station and have your thoughts together, because if you let that affect you, then it's just going to carry over. So yeah, I totally agree.
I guess so. Moral of the story, don't second guess yourself, especially during this process.
Yep. And the format of the MMIs again, so they'll typically just kind of leave things pretty open-ended. Like, for example, if they give you a scenario to work through, like they'll give you like a patient scenario, and they'll just be like, okay, go into the room and discuss with the interviewer what you'll do. They'll kind of sit and listen to your response, and then afterwards they may give you some follow-up questions. And the point of those questions is to, again, probe your thought process. Like, why do you think this would be the right way to go? Like, they'll maybe be like a devil's advocate. Okay, what if things happen a different way? And again, you can't expect what they're going to throw at you. It's just about you being agile and treating it like a conversation. Like if you're treating it like, you know, having coffee with a friend and they're just casually asking you, okay, what if you did this, what would happen? If you did this, what would happen? That kind of takes the pressure off, because they're really just trying to probe your thought process. They're not looking for a specific answer, nor is there a right answer to any of these questions.
Yeah, that's a great point. And a lot of times they will play devil's advocate, and it's important to not take that as a sign that you answered wrong or anything like that, because their job is to get information out of you and to be able to kind of tell how you're going to answer questions and approach problems. So just be able to kind of stay level if someone comes back with like a kind of a refute to whatever you said, because that's their job. And I agree with what it says on this slide, that it's important to take your time. So one of the worst things that you can do is just like start talking immediately if you're not sure what you're going to say. I would say it's always better to take just a breath and just think for a second, and you can even repeat back the question if that helps you to kind of get your thoughts together. And something that might be coming later on, but that I think is really helpful, is also to always mention that you would ask for more information in the situation, because that's never the wrong answer, if that makes sense.
Okay, so now that we've talked about the process, let's jump into the types of MMI questions that you'll get asked. I know this is probably everyone's here for.
So, you know, there are many different things that they can ask in any of these sections. And again, the time crunch is a little bit real as well, only 8 to 10 minutes. Sometimes they can just ask you traditional questions, but it's just one station, right? So that could be like the personal interview, just for 8 to 10 minutes. You're just having kind of like a mini traditional interview. Sometimes you can have ethical decision making. So they, again, give you like a scenario with the patient, like, oh, a patient said this, or, you have this sort of interaction with the patient family. What do you do in this situation? Sometimes they can have acting scenarios where you go in and, like pretend the interviewer is like a patient who needs comforting, pretend to comfort them. And then teamwork exercises can also be unique as well. Like you may be paired with someone in the room, or you're just instructed that, you have like an object or something, and you need to tell the interviewer how you best describe it, or the interviewer's back is turned to you and you need to describe to the interviewer how to draw the object that you're seeing. So again, it's just like communication skills. So it can be anything and everything. So again, you can't really prepare for it, but again, it's just a matter of being agile and not croaking under pressure.
Yeah. I would say for the personal interview questions, because they're MMIs and they're very short, it's not going to be a full personal interview, but it might be more targeted. Like, tell me about your research experience, or, tell me about this certain thing that I saw in your application, which is probably less common since MMI interviewers might not have like a full grasp of your application. But they might just ask you more specific targeted questions that are, about you. And then for the teamwork exercises, it works very similar on Zoom. I know that a lot of times they'll chat you like a picture, and then the partner that you're paired with will have to draw it on the whiteboard based on your instructions. So it's basically just trying to get you to communicate. And the goal is not to get them to draw it perfectly or to complete whatever task perfectly. It's really to see how you communicate. So keep that in mind. Like, you getting them to draw the right picture is not a win if you were like really degrading to them. So make sure you're like mindful of how you're communicating, because that's really what they're looking for there.
So I think we have a couple examples in these slides as well, which is good. So this is the example of that first thing, the personal interview, again, like they can be targeted, as Elle was saying, or they can be like even just very general questions like this, like, why did you apply to this school? So a couple things I just wanted to point out with this answer. Obviously you can say I want to go to this school because of these qualities, but if you pay attention to this response, they say certain names or certain details about the school, showing that they did their research. So for example, like, if you're applying to a school like Duke Medical School, and they ask you, why do you want to apply to this school? Obviously Duke is a great school, but then, maybe my interest is in this research in neurobiology. This is the lab that I'm interested in. This is the program that they have that would help me with that, and things like that. So it's almost like you've done your due diligence, and you found how can you build your own niche within the school, and it doesn't just sound like a canned response.
Yeah, that's really important. And even if you don't know what you're interested in, or you don't even have like a scientific interest from undergrad, I would say something you can always do is look up the curriculum of the school. There's usually small nuances, like at Duke, there's a whole year for research. At other schools, they might have like a longitudinal clinical experience where you're with the same person for a while. And so there's little things where they're specific to the school. And if you mention them, even if you don't know what you're interested in or the professor that you would want to work with, it shows that you've really done your research and you're applying there for a reason. The other thing I'll say about this question is that it's always good to have a question for the interviewer about the school. So at the end, they might say, do you have any questions about XYZ school for me? And you always want to have something to say, because if not, it kind of sounds like you're not interested. Because if you are interested, you're going to have a lot of questions about the school.
What are some examples of questions about the school that you could give that are, that you can have kind of in your back pocket?
Yeah, for sure. So something that's kind of common for schools to do is have a different length of time that the students are doing didactics. So some schools will spend 1 year in the classroom, some schools will spend 18 months in the classroom, some will spend 2 years. And so a question that would be good in that situation would be like, how do your students balance like the workload if you do all of the didactics in 1 year, and like how does that affect their clinical experience the next year? Or something where you're trying to see, how do the students handle it at your school? Like, how would I fit in? Or it's also a good time to say like, I saw that your students have this interest group and I'm really interested in participating in it. Do you know anything about that? Like, that's also a good question to ask.
Agreed. Thanks, Ellie. Okay, example number 2.
Yeah, so this example is more of those ethical questions. I think from my experience in MMIs, most of my stations were these ethical type questions, and then sometimes you'll have like these like interspersed other ones. But this is a good example, one that can come across in many different med schools. What would you say to a family member if they requested you to share a patient's private information? I've also heard of a different scenario where it's like, oh, there's like a terminal diagnosis and the patient's family asks you not to tell the patient. What do you do, right? So again, it's these ethical questions where it's like, okay, you're a physician, you're trying to take care of your patient, and how do you best navigate this situation? Because there's multiple parties that are invested in what you're doing. So this is, I think, this is a little abbreviated just for the purposes of the presentation, but the way that I like to start off with these is I like to first kind of summarize what these scenario is. So I kind of go in and I say, okay, my understanding is, this is the patient I'm taking care of, and a family member has reached out to me without the patient knowing, asking to see if they can learn more about what's going on with the patient. And then the way that I do it is I kind of like sympathize with all sides. I say I can understand where they're coming from. Like I can understand why the family member is concerned. So I'm trying to like demonstrate that I'm able to empathize with all sides of the party. Like the family probably wants to know what's going on with the patient. But on the other hand, my conversations with my patient are with the patient only. And so that's something that I have to respect as well, right? So I'm kind of acknowledging that both sides have rights, but both sides also have to be handled a little differently. And then from there, you can just kind of go into what decision are you going to make. So in this case, my decision is I would politely explain that I cannot give such details because of confidentiality. And sometimes it's really easy that you can just say, yep, this is the decision. Sometimes it's not going to be as easy. Like the one where they're asking you to withhold a pretty serious diagnosis from the patient, that's a little bit more nuanced and you can take a little bit more time for that. Again, you don't need to have a right answer. It's just more of explaining what your thought process is. So if in this question, if you just said, no, I'm not going to say anything, it's confidential, that doesn't really tell the interviewer much about your thought process. You did the right thing. I mean, that's what you're supposed to do for the most part, but I have no idea how you got to that, and I don't know what you were thinking. Were you even thinking of why the family member did that in the first place? So it's important to kind of voice out your thought process during the entire session.
Yeah, I think you did a great job explaining that, Aditya. And I would say the most important thing is to be able to see the problem from all sides, all parties, whether you agree with the party or not, and to vocalize that to the person interviewing you. And there's also some basic ethical principles of medicine that you want to be familiar with when and I'm sure a lot of you already are familiar with as you've answered secondary prompts. But you really want to know, like, an example of that would be to answer this question on this slide. If the patient was incapacitated, that's a whole different story, right? Like, the family is allowed to know that patient's private information. And so you could say that. You could take like different approaches and kind of show that you have a really good understanding of the topic in different situations. If you have time, like, that's a lot to fit into a small little MMI, but yeah, there's a really good website that I can put in the chat of like basic ethical principles that are good to review. It's from the University of Washington. And it's just a good thing to have in your back pocket and to look over before you go into an MMI when there's going to be a lot of ethical questions.
Thank you. That's super helpful. And then example number 3.
So this can all sometimes you'll have questions like this as well. It's just kind of like your knowledge of the U.S. healthcare system. I think this would kind of fit into that first like traditional format. You'd like walk into a room and this is the only question that they'd want to talk about is, okay, so what do you think is your most pressing concern in the U.S. healthcare system? Again, there's no right or wrong answer, but just whatever you go down, just try to show that you have a very clear thought process about it and you really justify your answer. So in this one, for example, if you think that one of the most pressing concerns about the U.S. healthcare system is limited access to healthcare in the underserved rural areas. Now, there are many different ways that you can make this answer shine. In this case, this person is tapping into their personal experience, that they are from a rural area, so they have firsthand seen how difficult it is to get care in some of these areas, how, sometimes like transition of care, getting referrals, specialists, things like that can really fall through the cracks. And then, there's not really a right or wrong answer. This is just one of those conversations. Just the more you talk, the more, they may prompt you with more questions. It's just about, justifying whatever you're saying and kind of being free flowing with it.
Yeah, I agree. And something to think about here is answer the question with an answer that you're able to elaborate on. So for example, if your most pressing concern about the healthcare system is the cost, but you don't know anything about the insurance structure of the US healthcare system, then you probably should pick something where you can talk intelligently about for a decent amount of time. So like, I could never talk about the insurance system for more than like 30 seconds, which is bad. And I need to learn that. But I could talk about, mental health in that crisis, and I could sound more intelligent. So pick something. You don't have to pick something where you're able to give more information, talk about your own experiences, and elaborate, even if it's not what you think is the most pressing, because it's not a right or wrong answer. It's just what you think and how you can elaborate on it and show another side of you in the interview.
Awesome. Thank you. Okay, the 4th example.
Yeah, again, this is just another traditional interview question. So why do you want to become a doctor? And again, this is going to be very unique for everyone. This one I think should be fairly solidified by the time you get to interviews, just because it's essentially what your personal statement is. So this is kind of more of like a free flowing and eloquently spoken version of whatever you're writing for your personal statement. Again, just because this is an interview format, you need to expect that they can ask you questions about the experience, or they can ask you to elaborate on certain parts or or kind of take you off your script. So just because this seems like an easy question that you've written a whole essay about doesn't mean that you can just kind of take out the whole script. You still got to be agile with whatever they may ask you.
Yeah, it's important to stay consistent with what you've written, but also not sound like you're reading off of a sheet of paper. So yeah, this is one of the harder ones, I think, because it's so broad and you have answered it in every type of way for your application already. This is one I would definitely spend time practicing because it's high yield, and even though it seems like you've answered it a million times, answering it in an interview is a lot different. And so I think it's worth practicing and like formulating an answer that doesn't sound scripted like your personal statement, so you can answer this one confidently.
Thanks, Ellie. I have a question, and you kind of hit it on the nose when you mentioned it was super broad of an answer. I have a question to answer. And I'm assuming that, everybody's going to kind of have a similar answer to this question where they had this experience that inspired them to be a doctor or what have you. How do you really make yourself stand out when answering this question?
Yeah, I think people ask that same question when they're writing their personal statement. And so to stand out in an interview, I don't know that it's as much about the content as it is about how you're able to relate to whoever's interviewing you and how you're able to kind of respond to any follow-up questions that they might have. Definitely don't pull something out of like thin air that you haven't talked about before, because that wouldn't make any sense for anyone that sees your application. But, at this stage, it's less about standing out with the content and more about standing out with the connections you're able to make with the people that you're talking to. If that makes sense, it's a little bit tricky, but you've done the hard work already. So now it's just about making those connections and being able to talk eloquently about whatever you've done and whatever's in your application.
Yeah, I agree. I think it's the content obviously matters, but they're not expecting something groundbreaking that hasn't been seen in your application before. It's more how you carry yourself, how you're able to speak about your experiences. If you wrote a really, really good personal statement that blew everyone away, and you're not really able to articulate it in person, that can be noticed. But if you still have that same passion and energy for the same story, and you're able to keep talking about it even when prompted with questions, that's a good way to go about this interview.
Awesome. Thanks, guys. Okay, example 5.
Yeah, and again, all these questions. So a lot of the questions that we have in this presentation are for those traditional format questions. Just like, even though we're focusing on MMIs, these can pop up in those stations. And again, it's just about being agile. The reason we put this question in is because, at least for me, this is one where I would read this, and this is one where I would freeze, because it's like, oh, okay, I have to think of something negative about myself. I only have 8 to 10 minutes. You're very likely to ramble. And so this is one of those this is one of those questions or examples where, if you feel like you're kind of like deer in the headlights with the question, it's important to take some time to just think about what your answer is, and focus on being more concise, and just kind of prompt with what you're saying. So I'm trying to see how they really did this one. Even now I'm kind of struggling with it. So it's for this one, it's just a matter of not over rambling or talking too much to try and fill space. And you're very likely to do so, especially because you're already in this mindset where, oh, this is a very tough question, and you're looking at the interviewer and you're wondering if they like your response. You think you need to keep talking more, and that's not the case here. You just kind of have to stick to whatever you think of in that moment, in that minute or so where you prepare the answer, and just kind of hope that carries you through.
Yeah, I think there are certain questions that are worth practicing, like I said, about the why do you want to be a doctor question, because even if it's not verbatim, what is your greatest weakness? It might be, what is something that that you regret? What is something you wish you'd done differently? Like a spin-off of that. And if you really don't want to encounter this question, because it's kind of like one that you want to have an idea of how you'll answer it, you don't want to encounter it for the first time in an MMI because it's a big question that requires some reflection. And so I would say, what is your greatest strength? What is your greatest weakness? Is there anything that you wish you would have done differently in your life, or a moment that stands out, or something like that? Some basic ones, especially the strength and weakness, are good to have a basic format for how you're going to answer. And then pick something that can still show like growth and professionalism. Like, don't say my greatest weakness is that I have an addictive personality. That's a bad idea. Like, don't say that. Maybe that's your weakness, but not the right place to say that. It could be this answer is good, like problems with delegation. It could be problems with, I think something a lot of medical students run into is with, work-life boundaries and stuff like that. And that's another one that's good to talk about. So just pick something that's going to go over well.
Perfect. And then, I think that was the rest of our examples. So let's jump into the list of schools that use the MMI format.
Yeah, so this is not a fully exhaustive list, but this is like a list of like a lot of the schools that people tend to apply to quite a bit that will have this MMI format. And they're typically kind of along the same lines, like 8 to 10 stations, about 8 to 10 minutes in length. And you're really not going to know what they're going to have, right? Like all the MMIs that I went through, they were all very different in their focus and strategy. So I think it's just important that if you do get to the interview stage, just make sure that you know whether it's an MMI or not, so that you're like preparing in the right way. You don't want to like walk into like Duke's interview, for example, thinking it's a traditional interview, and then all of a sudden you're hit with 8 to 10 stations and you feel very out of place. So I think it's just we're just trying to emphasize to do your research and know what the type of interview is before you go in, because now it's getting a lot more variable.
And schools will usually send you almost always an email explaining what interview day will look like, especially if it's on Zoom. They have to send you an email with the Zoom link anyway. And some other schools won't have a fully MMI interview. I know of a few schools that might do 1 30-minute interview and then 3 6-minute interviews or something like that. So even if a school is not fully MMI or listed as an MMI format, they might still have components of that. And so yeah, it's important to know what you're walking into, because it will change how you prepare. And so whether that's looking on the website, talking to people that that have applied there, or just read the emails that they send you, and you will be good to go.
Okay. And how is the MMI scored?
So this is where that standardization comes into place. Like if you have 8 to 10 stations and you just finished your 3rd station and you feel like you really bombed it, like that's happened to me before, where it's like I really didn't do very well on that. That doesn't mean that the entire interview day has gone to waste. It's only 1 station. And if everyone's rating you on the same scale of like 1 to 10, and you scored like a 4 or 5 on that station, but everything else has been like a consistent 8 or 9, that low score will be averaged out. Like that's the benefit of the MMI, is that if you have one bad interaction, whether it be just because the interviewer or you were just thrown off guard by the type of question, you have multiple chances to redeem yourself, and it's an average of your performance.
Yeah, I would just echo that. And what it says about attire, maybe it's officially evaluated. I know it probably it does make a difference, especially in person. So just wear something professional. And if you're on Zoom, wear something really nice that you can see in the camera, like a blazer, if you're a female, or like, I don't know, a coat, whatever you guys call it. But wear something that you look professional in. It's just not a good look to show up in something like a t-shirt. So don't do that.
Perfect. Okay, and here are some tips to help you prepare for the MMIs.
Yeah. So I think a lot of these we just kind of threw out there while we were talking about everything. Obviously, research the school and figure out what type of format it is, understand the MMI format, which we've gone through pretty extensively. The most important things I think here are going to be tips 3 and 5, just like practice with as many sample questions as possible. There's like, you can Google sample MMI questions or even just patient scenarios. And the way I tell people about this is you can't anticipate what question you're going to be thrown, but you can kind of anticipate what story you're going to use. You have a certain number of experiences that you know very well. And if you really try to like brainstorm and try to think of everything, like you just try to think of like situations that have happened in those experiences, you're going to be more quick to kind of pull an experience when they ask you a question. Like if they say, okay, tell us about a time that you failed, and like, you've thought really deeply about your top 3 activities and there was one where you struggled a lot, you can just kind of quickly pull from that one and say, okay, this is where I showed that quality. That's the advice I always give, is you're in control of your own experiences. So know them very well to the point that you can quickly shift them into the format of the question.
That's really awesome advice. I wish I would have heard that when I was interviewing, because if you have like 3 or 4 really solid experiences that you can use, say one of your experiences you can use for like, it has a good point about hardship and adversity and also like diversity, equity, and inclusion. And you just know that that's one that you can pull from for those questions. Then you have another one that you can use for why you want to go into medicine. Then thinking of it in that way is really helpful to organize your thoughts when you're asked a question and you have just a few seconds to think of an answer. Always practice talking with someone. In front of a mirror is fine too, but I think it's better to practice with someone because you're able to kind of have that awkwardness and like the silence or whatever the dynamic is. So practice is really key. I'm trying to think of other good tips here. Oh, if you have a really big experience, that's great, but don't answer every question with something from that same experience. I ran into that sometimes. Like I had one thing that I thought was really great that I wrote about in my application, but you don't want to answer every question with the same experience. I guess in an MMI you have different interviewers, but it's always good to like be able to talk about different things from your application. So make sure you reread your own application first and then go from there.
All right, awesome. Thanks, guys. Okay, so we've reached the Q&A section. So if you have a question about anything that we've talked about MMIs throughout this presentation, leave a question in the chat box and we'll go ahead and answer that for you. I think I see one already. Would you guys give examples? I'm assuming that's talking about the questions. I just want to address, we did kind of touch on that within this presentation. And if you need to go over it again, we will be sending this presentation out again afterwards tomorrow. So you'll be able to access any of the answers and questions that we've talked about. But is there any kind of question that really kind of comes to mind as a really important question that you'll be asked on the MMI, or maybe a question that was kind of like a curveball in your experience when you got asked it, or is it kind of just like same across the board?
I think a lot of the curveballs are like a lot of the curveballs are those like scenario questions where they just kind of tell you just about a patient interaction, and then you have to just kind of justify how you handle it one way or the other. And those can just throw you off because sometimes they can be very, very difficult and very nuanced. Like the one I talked about, the patient's family didn't want the patient to know about the diagnosis, right? Because you could just very quickly be like, oh well, that's not going to happen. It's me and the patient, and that's all that matters, right? Again, but like that doesn't show your thought process. So it just, because there's so many different points of view, the strategy I took was just kind of, again, like I kind of thought out loud and just kind of said, okay, this is what I think here, but I can also see how this could be applicable and this could also be applicable. And that way I just kind of tried to show that I'm thinking about everything. And then I finally narrowed into what I was going to do for that situation.
Yeah, I think some of the hardest questions that I was thrown were like, what would your walk-up song be to this interview? Or like, if you were an ice cream flavor, what would you be? Not every school is going to ask you questions like that, but they will, like some will. And sometimes that you're just like, what in the world? And practice with some really random questions like that, because you just never know. And if you're able to think of an answer for that question, that's a good sign that you're probably ready to think of an answer for a lot of questions, especially since you've written an application full of experiences.
Such a good tip. And thank you, Aditya, for adding a blog for how to prepare for the MMI. Oh my God, I'm losing my words. So thank you for that. If you have any more questions about the MMI, feel free to reach out and check out the link that Aditya posted in the chat. There's some really great tips in there as well. I'll leave the floor open for a couple more questions, but I'm curious to know, we know that a lot of schools do the MMI, but a lot of schools don't. Based on your guys' experience, do you think a lot of schools are going to cater towards maybe transition towards using the MMI, or is it still kind of like a new thing?
I don't think it's new necessarily. And I think, with people wanting to be as unbiased and fair as possible, that it's probably going to be a trend. And I think that a lot of schools keep using it because they've had success with it. So I would expect to see MMI interviews or MMI incorporated into some of the more normal interviews that you see more and more. I mean, that's what I think. What about you, Aditya?
Yeah, I think so. And I heard of some schools using like a new thing called like Casper. So they kind of have like an MMI format, but it's just kind of like a written prompt that you have to answer before the interview, before your interview date. And so I think they're trying to just collect more data and understand how you think through situations. And I think they're slowly realizing traditional interviews may not do that.
Totally. And that's a great point I meant to bring up earlier. I think Casper was pretty new when I was applying, and it's still around for some schools that are requesting it. The way that you prepared for Casper, if you took it already, is a great way to prepare for MMIs, because it's very similar. You're given a scenario, you have to respond. So do what you prepare how you prepared for the Casper, and that's a good starting place for the MMIs for sure.
Awesome. Really great points there. I think we'll go ahead and end it there. I want to thank everybody for attending. Got some really awesome insights about MMIs through this presentation. Just a reminder, we will be sending this out tomorrow, so you can review in case you missed something. But I want to give a special thank you to Elle and Aditya for being our panelists, and thank you so much for your insights. Have a great night, everybody.
Great. Thanks so much.